Welcome to another episode of Red Dot Cafe. I hope that you're enjoying your week so far and getting outside and getting a little sunshine. Thank you again for being a part of our wonderful series, and we hope that this live stream brings you a little value and inspiration in your day-to-day life. My name's Angelica Cordero. I'm the TEDxSanAntonio licensee, and I'll be your host for today's event. We want everyone to take part in this conversation, so please leave your questions and comments for our speakers in the thread. As the chat continues, I'll be monitoring the feed and hopefully be able to bring up these questions to them later in the show. We're happy to be joined today by 2016 TEDxSanAntonio speakers, founder and CEO of Unit Innovations, Ethan Aldrich, and Chief Medical Officer, Clinical Strategy and Innovation at Healthcare Service Corporation and National Medical Advisor for Telemundo News, Esteban Lopez. In 2016, Ethan argued for a need to close the technology gap for institutions like correctional facilities. That same year, Esteban shed light on the lack of access and equity in the US health system. Today, they join us to reflect on their talks, life since speaking, and how the current crisis has impacted technology in healthcare. Please join me in welcoming Ethan and Esteban. Hello, guys.
Hey, how are you?
I'm good. We're so glad to have you here today. I was hoping that maybe you would start a little bit by reflecting on your TEDx experiences and a little bit on life since speaking.
Great. I just want to provide just a quick clarification. I'm actually no longer at Healthcare Service Corporation. I was there for a good 7 years, but departed in January of this last year. So excited to have started my own consulting business in addition to doing some clinical work.
Awesome. Yeah, since TEDxSanAntonio, I took off to Stanford and I got to meet some unbelievable people. I'm still growing my company that I originally talked about, providing technology to jails and prisons. We've grown to California, Oregon, Washington, Hawaii, Virginia, Illinois, Alabama. So we've grown a ton since then, and it's been an awesome experience. But Esteban, I'll let you kind of kick off on all this COVID crisis.
Yeah, no, well, since TEDx as well, I did, round out my career at HCSC and ended up doing a whole lot of stuff around health equity, which the topic of my talk was about. Still a huge health equity champion. And as we look at COVID-19 and the coronavirus, health equity is up in center, at the forefront. So what we've seen, for instance, in New York is that the largest number of deaths are in the Latino population, followed by the African-American population. But as a nation, we've seen African-Americans really over-index in the morbidity and mortality associated with COVID-19. So it's timely in terms of trying to figure out how do we address those health inequities and health disparities that various populations face. So I think that's going to be a topic for years to come.
Absolutely. I'm really glad Angelica brought us together because you talk about health equity, and especially in jails and prisons, like you think about, a lot of people think about what's an essential business right now, right? And I'll bet you most people don't think about jails and prisons, but these places are still open. These places still have people in custody from all across backgrounds and staff members as well. And they're really just melting pots of this COVID crisis. Like if something gets in there, not only does it affect people that are really sitting ducks, but you're infecting people that are staff members, correctional officers, administrators who go home to their families, who go back to the grocery store every single day. So talk about health inequity is like perfect in the lens of jails and prisons, which most people don't think of.
No, I think about it a lot as well because, as you know, Ethan, jails and prisons over-index in terms of their population from people of color, Black and Latino, significantly over-index in jails and prisons across the United States. So in addition to that, we see essential health workers also over-index, be it from the janitors that work in jails and prisons to the food workers to the guards, et cetera. So it brings to light a much bigger discussion about race and politics as it relates to healthcare, as it relates to social justice. I volunteered about a week before the lockdown down in Dilley, working with the moms and kids who are being detained there at the detention center. They call it a residential facility, but really it's a jail. It's a baby jail. That population who is already traumatized, having heard the stories of all the women that have come across, not one has not had a harrowing event that made her leave her home country, be it Guatemala, Mexico, Honduras, Brazil, Haiti, to get to the United States to seek asylum, and then only to be at risk for COVID-19 in that detained population.
Exactly. And like even more on the equity standpoint of this, I was telling you a little bit about it, but I spent the greater parts of 2 weeks, like every single day and night, trying to get PPE supplies to these facilities, jails and prisons and community correctional centers. And like while we talk about, they are almost pinnacles of like communities, like they affect so many people in the community, and especially the populations you were discussing. And while they're so important, they're almost last on the list to get these critical supplies. They're almost last on the list that people think about, but they affect so many different people. And when you have these PPE supplies coming in, they're not the first ones to get them. They're the last.
Well, and on top of it, you think about yourself, your family, your friends, and the stress associated with COVID-19. So a lot of folks are stressed. They're stressed because they're, at home. They're stressed because they're worried about their loved ones. They're worried about themselves. There's a lot of headlines about the virus, and some, many of them are sensationalized. So further imagine that you have a detained, imprisoned population that has no way to protect themselves. The only way that they have to protect themselves is dependent on others within that jail system or that prison system. So they suffer from the same mental anguish and stress associated with the virus, because they may still be seeing the headlines on the news in the rec room or things like that, and seeing the number of deaths. And they on top of being in prison, they're also having the stress of saying, what if I get the virus? I have no way to protect myself from it.
Exactly. And they don't even have the kind of, while everyone is going through this and et cetera, they don't even have really the support systems. I mean, I got over 1,200 calls in one day just from small jails in rural communities, and even large jails in like metropolitan communities and state prison systems. And they're not getting that support from the state. They're not getting that support from the federal government. They're not getting that support from the community at all, because like we just talked about, they're the last people on this list.
Well, I've been lucky enough to be on national news for the greater part of a month, talking about COVID-19 and being able to bring to light some truths and debunk myths about the virus and how people get it. The reality is the vast majority of us who get the virus are going to do just fine. We're going to feel sick, like a really, really bad flu. Some people will be completely asymptomatic, and that's problematic because we have no way of testing those folks, but the vast majority of us are going to be fine. The issue that we really need to worry about is about those folks over age 65. And so our moms, dads, our grandparents, folks with serious health conditions, especially heart disease, diabetes, morbidly obese folks, immunocompromised folks, folks with cancer and chemotherapy, pregnant moms, and newborn infants. And as we think about what is social distancing and how do we protect ourselves, why do we need to wear a mask when we go outside, it's really to protect that population. Because as you've seen the number of deaths, especially over age 65, the percentage, or what's called the case fatality rate, and all that means is the people who get the disease, the percentage that die from it, goes significantly higher. And especially when we hit the 80 and older population, it goes even higher. And so unfortunately, right now, we don't have great numbers of case fatality rates because there's a lot of cases that go undiagnosed, meaning we don't have enough tests for those who are mildly ill or for those who potentially may be asymptomatic, who were a sick contact or a contact from someone that was sick. So we would assume that the case fatality rate would go down as a total population, but that brings to light another issue in terms of tests and having enough tests to be able to do surveillance of the entire population. What are you seeing in the prison system?
Well, just on the test, you kind of gave a nice trigger word for there. I've had so many different jails and prisons, whether it's PPE supplies or COVID tests, that they can't get them. And the ones who claim that they're getting them, they'll send in a PO to some middleman that's trying to do something during this crisis and everything, and they're weeks long delayed. And they can't spend this money out. There's a ton of problems in the supply chain of getting these PPE supplies, getting these tests, making sure they're prepared for this at all. So seeing that in jails and prisons it's sad, because like we talked about, they're last on the list, number one, and then number two, they're not getting what they need at all to prepare. They're not getting what they need to mitigate, and they're not getting what they need to recover. I mean, they will probably be dealing with this for the greater part of the year because their recovery is going to be last on the list. They're going to start bubbling up when other places begin to get better.
Yeah, one of the things, I get a lot of, having been on television, I get a lot of questions through social media, Twitter and Facebook about, what to do. And people are really hungry to be able to do something to protect themselves. And really, I like to empower folks to say, you can protect yourself. Yeah. And how do you protect yourself? By staying at home, you protect yourself. By washing your hands frequently when you're out, with soap and water for 20 seconds, you protect yourself. By avoiding touching your face, especially your eyes, nose, and mouth, you protect yourself. By wearing a mask, you protect yourself, because if we all wear masks, we're all protecting each other. So we do have to protect ourselves, but it's funny that a lot of focus on things that they can, physically control, because you can't control a virus that you can't see, or who is flying, in the air within 6 feet. So people are really focused on, do I need to clean everything that I buy from the grocery store? Do I need to decontaminate when I walk into the house? Do I need to do a whole kind of very elaborate receival process of any takeout food? And the fact of the matter is, I'll tell you what I do. I mean, I'm not going through a decontamination process unless I'm coming home from the hospital, seeing patients. And I typically do that in general when I come home from the hospital, because there's a lot of bacteria. There's a lot of things that I don't want to bring that home inside the house. But, takeout, I'm not necessarily wiping down the boxes, wiping down the bags. Stuff from the grocery store, I'm not doing that either. Why? Because the risk of getting the virus that way is so incredibly low. If people want to do that out of an abundance of precaution, they can do that. But the fact of the matter is, how we get the virus is through respiratory droplets that are spread being in close contact with someone who is actively sick, coughing, sneezing, things like that, or who is having what's called asymptomatic shedding. And they can shed the virus and respiratory droplets just talking, right? Because we kind of all will have some spit when we talk. And that's really how you get the virus. Of course, if someone sneezes in their hand and then touches a grocery cart, and you come after them and you touch that grocery cart, and then you touch your eye, yes, you can auto-inoculate, auto-infect yourself. And that's why being really conscious of your hands and where they go is so important.
I wanted to hop in really quickly because there was something that Ethan said that I think ties really well into the general population and the things that you're talking about, Esteban. I think that, a lot of people don't consider about how the correctional facilities can impact the greater population. And so I'm curious if you can speak to why it's important for us as a general population to be concerned about what's happening with the virus in the facilities and how that impacts us as a general population.
I guess the best example is a nursing home. So nursing home is, a lot of patients in nursing homes, I don't want to call nursing homes a jail, but they're really not mobile outside of the nursing home. They're in a confined area. And so a virus can spread through a nursing home. And we've seen just the headline this morning of 17 dead bodies in a nursing home in New Jersey that were found. And so it's a way of being able to infect a large population very quickly. But the problem is, it's obviously that population is contained, and it's unfortunate for that population. And most most people in jails and prisons tend to be younger. So the majority of them are going to do okay, but there's going to be some that are going to be older or have what's considered comorbid conditions. But it's really about the guards and other workers that work within that prison system that are mobile, right? They have to go home to their families. They have to go shopping at HEB. They have to go to the pharmacy or whatever. And if they get infected, they go out to other parts of the community to infect as well. So jails and prisons are an area where you can spread that virus like wildfire and then infect a lot of the people that work within that prison, who then take it out into the community. And it's very similar in terms of what we've talked about in churches. And so there's a big controversy that Governor Abbott has made churches essential places. Well, those people that go to church, they may infect themselves. I mean, churches are a perfect place to do that. People are chanting, singing, responding, spreading respiratory droplets through a confined space. We've seen the choir that, half of them got COVID or more in Washington. A huge percentage of those folks died. But those people that go to church also come into the community. And so it really becomes dangerous for the entire community.
Yeah, and when you think about a jail too, and to be honest, this might change the criminal justice system for a long time. Might be something that really kind of is that trigger for what a lot of people are calling. But when you have people, especially in jails, who are going there for 2 or 3 days or a day, just booked in because they did X, Y, or Z, or they're there for a week or 14 days. Like you said, a lot of them are younger, but being an asymptomatic spreader, you can easily pick it up in these facilities. You can easily bring it to these facilities and infect, just as you were saying, infect people that it will cause, even if it doesn't exactly affect you. So you have these facilities and you have these communities really in and of themselves, fending for themselves, who don't have the recognition at all of how important it really is to the greater community. And you have, like you said, you have staff members coming in, you have janitors coming in, you have administrators coming in, and then you have the people coming in for a day, 2 days, 24 hours, 6 hours. So we've seen a ton of different counties and states and local jails who actually, like I believe it was Philadelphia or something, they're not arresting people for certain crimes just because of the risk of this. And a lot of people are saying, my gosh, this could totally change criminal justice, because now you're actually looking at it from, do these people ever need to be jailed? And I think it's really important because people are beginning to see that of like, who are we actually jailing? Why? Who are we putting at risk for all of these different, not only on their life, but especially now with this disease. So there's a ton of different criminal justice organizations who are kind of spreading light on this. And I think that's important to see. And also important to know that for your facility or your community who may not be doing that, if your local sheriff may not be doing that, your county, you're creating just a lot of unnecessary risk for not only the people at the jail, but really the broader community that affects your mom, your grandmother, your friends, your family, that you never would have expected a jail to affect.
You're absolutely correct. And the fact of the matter is that young people, we don't have the data for the United States because we're not doing aggressive testing like they did, for instance, in South Korea. South Korea, a huge percentage of folks got tested based on what's called contact tracing. So people who have came up positive, then you would look at their contacts that they've had. And what did they see in South Korea? That they saw the largest percentage of infected folks were 20 to 29, who were either mildly ill or completely asymptomatic. So jails are perfect for that. To your point, people that come in get booked and then leave back into the community. They get infected. They never know they're infected. They never have any symptoms, and they take it back and infect others.
What other changes have you been seeing, kind of like more long term? Like I mentioned one of like criminal justice. I think it really will shed more light onto like, who are we jailing? Who are we putting in prison? How is this affecting our community? At least within some people staying updated with it. And then of course there's some different technology ones I'll touch on, but do you have any different, what have you seen changing?
Oh my gosh. I think COVID-19 is the ultimate disruptor. It's disrupting healthcare. It's disrupting HR and how people work. It's disrupting, I can't think of a business other than, I mean, it's even disrupting grocery stores in terms of logistics, right? So it's really disrupted almost every business in the country. From a healthcare perspective, which obviously is the one that's closest to me, we've fast forward 4 to 5 years in terms of telemedicine. I mean, this is where we would have been probably organically 5 years from now. COVID-19 forced people to who weren't even anywhere near telemedicine to suddenly go overnight. And we're learning a whole lot. You know, it's disrupting even like the search process, because people who are applying for jobs right now, some people are taking jobs sight unseen, haven't traveled to a location, they're just doing video interviews. So we'll know 6-9 months from now, is this, you know, as we study that cohort of people that were hired during the coronavirus period, did they stay longer? Did they stay shorter? Did it affect their retention rate, their productivity? Were they good hires, bad hires? Was it break even? I mean, it's just so many different parts of the economy that it will be very interesting, you know, a year from now to do, for lack of a better word, a postmortem on COVID-19 and see how it affected different businesses. And it's going to change how people do business and how they work.
Yeah, no, I totally agree. I always think in terms of, especially from Silicon Valley and kind of this technology end of all these different people. And I'm part of this program called Y Combinator. And in our forums and even just people I talked to over there, from February, you see the conversation of consumer apps or marketing or influencers, et cetera, et cetera, et cetera. None of which is bad, but beginning in March, you had literally thousands of some of our like best entrepreneurs and technologists like switch to looking at biotech, vaccines, supply chain, critical infrastructure, telemedicine, like really important foundations like of society in every single aspect that most of the time they wouldn't have looked at. It's just a large bureaucratic industry, just like I talked about in the original TED Talk of, is technology really progressing everywhere? And it's interesting to see how this whole COVID situation is causing a total rise in telemedicine. It's causing a total rise from work from home and different education styles. Like my little brother's doing all his high school homework online with teachers who have never used video conferencing ever. So you're seeing all of these changes of these critical pieces of society that have needed it for so long, whether it's jails and prisons who are finally like, okay, what technology, what mitigation strategies, we need to do something here. Whether it's education saying, well, now we have to change, or people digging into supply chain, like some of these really bureaucratic, large, hard industries to change. And people are like, it's a necessity, not only for themselves and making a business during this time, but also just the world in general. These are important aspects. In fact, in my opinion, probably more important than the next app on your phone or something. Very critical pieces to society that it's really cool to see like these type of people in the Valley move towards these problems.
Well, think about the environment too. You know, there's been lots of studies recently about particulates in the air and how they've gone down. The environment hasn't been cleaner all across the planet during this time. So if we think we're...
Oh no. Oh no, it's just in such a great place. Let me see if I add him back in real quick. Oh no. Well, as we wait for hopefully to get Esteban back in relatively quickly, you know, one of the things that I've been kind of looking at over the last several weeks has been misinformation out on the internet about things, and I'm going to just pop him in real quick before I ask this question. I'm so sorry that happened. So I was just saying that there's a lot of misinformation out there currently surrounding the crisis, the virus, the vaccines. I mean, we've even seen the conspiracy theory about 5G regarding the virus as well. And I'm curious if the both of you could weigh in to provide some insights for us in the general public as to how do we best look through a lens of being critical to understand what is actually valid and what is not. So
I'll start. I mean, one of the things that I do is I look, anything I say on television, I have personally validated. And obviously, in order to validate that, you have to do research. Not everyone has all the time to do research, but I would say the two organizations that are pretty much go-to for me are the World Health Organization and the CDC, both of which have public-facing information that I believe to be valid. Following that, I would go to the FDA that has public-facing information that's valid, and then the Food and Drug Administration also has public-facing information. So if you had nothing else to look at, I would look at those four organizations because by and large, the majority of what I've seen on there has been well validated.
I'm curious your thoughts on this, Esteban. Like looking at CDC and WHO, like they are great organizations, but their information like does change as they learn new things. And I think a lot of people begin to, like, my Twitter feed is full with people making fun of New York Times or Vox or someone else for like mistaking it in like January or February, saying, oh, it's not a big deal. Oh, you don't need masks. Oh, now you do need masks. And it leads people to make them feel like, okay, CDC and WHO, they don't know what they're talking about. Or like I'm not going to listen to them because their information's always changing. Like, I'm just going to do like what my friend tells me is probably best, or how I feel is probably best. So how do you kind of think through like how to handle these like changing informations and like different information, and these people telling you that like these organizations aren't true? New York Times, like, here's evidence of them saying COVID's not a big deal. Here's evidence of them saying don't wear a mask, and now they are. So while they're not wrong and people's information changes, how do you kind of think through that?
Well, I think a lot of the information is based on studies. And so people may not have validated studies to suggest that wearing a mask is going to be protective. And so, for instance, wearing a mask is not about protecting yourself, especially a cloth mask or even a surgical mask. The one mask that protects you is an N95 mask. And we don't have enough N95 masks to get out to the population, to get even to healthcare workers, much less to the entire population. So masks, really, if you have the entire population wearing masks, so states like New York and California that have now mandated if you are going to go out in public, you have to wear a mask. That mask protects everyone else. When I wear a mask, I'm protecting you because it's capturing my respiratory droplets. Mm-hmm. So it doesn't protect me from an aerosolized droplet, and it doesn't protect me from a droplet that might go around the mask where it may not be tight fitting, right? But by and large, most of it is spread through respiratory droplets. So if everyone is wearing a mask, then the population as a herd is protected, right? And so the other thing is that the World Health Organization, this is a novel virus. So there wasn't a lot of experience. China reported it out to the World Health Organization on the 31st. So yeah, it would be hard for them to say in 10 days, this is, all fact, all true. Oftentimes it's not enough information. The biggest concern that I have from that perspective is that when we did have enough information, we as a country did not act. Individual states acted. So for instance, California, hats off to Governor Newsom and hats off to those 7 counties that did that hard task of locking down. But for instance, as a country, South Korea acted very early. South Korea and us, we had the first documented case on the 21st. But on the 12th, South Korea started making, as soon as China released the genome, South Korea started making test kits. And so they had a pandemic plan that was off the shelf that they were able to take. So remember, the World Health Organization is having to deal with the entire planet. Most of their investments tend to be in Africa and in the Middle East.
We have a question from the audience I wanted to bring up. It's a statistical question for Dr. Lopez. When estimating the case fatality rate, is anyone adjusting for the fact that asymptomatic people go untested? If so, what are those adjustments?
So that's what I said earlier, is that our case fatality rate right now, as it's seen, is based on the actual documented cases. It is not adjusted. If we tested more people and more people came back, positive, but survived, had asymptomatic symptoms, then the case fatality rate would go down. So we have different countries will have different case fatality rates, also because the healthcare system will influence the outcomes. So a country that doesn't have a robust healthcare system will have a higher case fatality rate just because they don't have the resources to take care of sick people. Or if a country ends up having, for instance, a huge peak like Italy did, right? So Italy was, they had a huge peak early on. They didn't flatten a curve. And they have an elderly population. It's the oldest population in Europe. So we would expect a case fatality rate to go up because you've exceeded the capacity of the healthcare system. So people will die as a result of that, not necessarily just because of the virus.
Thank you guys both so much for being with us today. It has been just mind-boggling to hear the both of you speak about your insights and in your area, specific areas of profession. We're right at the top of our time. I've really appreciated it. Again, I wanted to see if you had any parting thoughts, any moments of interest, of positivity that you think that you would like to share with our audience.
Ethan, why don't you go first?
Yeah, I have a funny analogy I like to tell people for this, and it's like to consider the platypus in like situations like this. And when you think about a platypus, you have an animal with duck feet, an animal, the mammal that lays eggs like a bird, the weirdest animal ever that's evolved to keep up with insane situations where it lives. And that's kind of how I see it for people or businesses or your community. It's like evolving is it's not the worst thing, and keeping up with these changes, like it's incredibly stressful, it's incredibly hard, but being adaptable and like being like the platypus in your daily life is like pretty important to me.
Yeah, that's a great analogy. And I love the platypus, it's one of my favorite animals. First, I want to start with thanking TEDx and TEDx San Antonio. Ethan and I have become, I would say, good friends since we met, 4 years ago on the TEDx stage. So we've been able to work together and collaborate, and it's been amazing. But when it comes to these difficult times, I want people to understand it's going to get better. Humans are incredibly resilient. We're going through some tough times, and we will have some tough economic times afterwards, but human ingenuity will get us through this. The majority of us are going to be just fine, and we are empowered to be able to control this virus. And we can do that. We can stomp it out by following those simple rules of staying at home, washing your hands, protecting your elderly, and staying at least 6 feet apart.
Thank you both again so much for being a part of our Red Dot Cafe. I really appreciate it. Again, we'll see you soon.
Thank you.
Thank you all again for yet another episode of Red Dot Cafe. We hope to see you again soon. You can always watch episodes on our website at TEDxSanAntonio.com/Red Dot Cafe. And we will see you shortly. Please enjoy the beautiful weather outside. And remember, as Ethan said, the platypus.